If somebody is interested in becoming a kinesiotherapist, they're going to have to go through an accredited program through a university that provides kinesiotherapy as a curriculum. And that program is a 4-year program that's going to encompass a variety of base classes or classwork like different sciences and maths. The coursework may also entail the student to go through classwork like anatomy, physiology, pathology, neurology, and a lot of other different coursework that may make them a well-rounded student and also develop them more scientifically and familiar with the human body and how it works. From the coursework, they transition into an internship program, which consists of bare minimum 1,000 hours. And that entails that student going through high-intensity training, hands-on training, working under direct supervision of a registered kinesiotherapist, in which they are performing duties in which they would do in the profession. Depending on where that student goes for their internship, depends on what type of training specifically they're going to receive and what type of patients they're going to be exposed to. Once a student has completed the coursework and the internship program that have been approved by the council and the accrediting bodies, they are allowed to sit for the registration exam. At that time, they'll either pass or fail, and of course if they pass, they become a registered kinesiotherapist, and at that point they're able to start practicing kinesiotherapy, and they can start accepting referrals from physicians or those persons that are privileged to do so, and start treating patients and start making a difference. I think it's important for insurance companies to know when they reimburse for kinesiotherapy services that they are reimbursing for somebody that's highly professional, qualified, and the services that are being provided are very beneficial to the patients, and in long term they're going to be saving themselves money over time, because what we're doing is we're keeping those patients out of hospitals longer, we're keeping them in their homes longer and out of nursing homes, we're keeping them out of the emergency rooms for falls and things like that, because we're doing long-term care with them, strengthening them over time, making sure that we're reducing the risk of further disease and injury development.
A registered kinesiotherapist is a healthcare professional who has been trained and educated at an accredited university and who has completed the appropriate internship to take the registration exam that has been approved by our Council of Professional Standards. Once that therapist has passed that exam, then the doctor can trust and the doctor can know for sure that the appropriate treatment plan to that specific patient's problem is going to be addressed, and it's going to be addressed well. A KT wants to work for the physician. A KT needs that physician referral in order to do our jobs, and that is to help the patient get better. Without that, it just can't take place. It can't happen. Whether it be through a wellness program or through a program within a hospital setting or a private practice setting, once that doctor has given us permission, so to speak, to start treating that patient, then the process of that patient getting better, getting stronger, increasing that patient's functional independence begins.